Sales mastery and communication. I help dentists earn more, work less, and have more fun doing what they love through this program. Course Introduction. If you have reached this video, the chances are that you are a dentist who is working super hard in a high volume practice, or a dentist with great clinical skills but not busy enough to be able to produce high production numbers. You could also be a mid-career dentist who wants to learn how to work smarter, not harder, and earn more, or a dental associate who likes to earn more in your current job. Whoever you are and whatever is your reason for tuning in, welcome and thanks for joining me on this presentation. My name is Dr. Alan Nazari, and I want to help you earn more, work less, and do the procedures you love. As a matter of fact, I want to help dentists all around the world to earn more and prosper beyond their expectation. I also want to reduce your stress. Dentistry could be very stressful. See, many dentists end up doing the procedures they don't like to do in order to meet their daily production goals so they can pay their bills. I remember doing molar root canals for the same reason. That became a big source of stress for me as I was not good at them. Dentistry is already stressful, and doing the procedures we don't like can add lots of stress to us, and that stress gets passed on to our staff as well as our families at home. I think most general dentists have 2 or 3 favorite treatments and they're very good at them. However, they get involved with other treatments that they don't enjoy or are very good at in order to make the money and pay their bills. I was certainly one of those dentists the first 3 years after I had graduated. See, I began my career in a private practice working for a high-volume, low-income dental clinic. The dentist who hired me was my mentor at the time, as I did not have any other mentors, and I thought the way he practiced dentistry was the norm. See a lot of patients, delegate as much as possible to your assistants, and jump from room to room like a rabbit. After 8 months working as an associate, I ended up opening my own practices, and I became extremely successful in this dental model by the time I was 29. I had several dental clinics and managing hundreds of employees. However, on my 30th birthday, I ended up on a hospital bed with an atrial fib, and I had to have a cardioversion where they put me to sleep and shocked my heart twice to get my heart rhythm back to normal. My doctor told me this was due to my daily stress, managing hundreds of people, and I had to take it easy. Desperate for help, I began searching for ways to work smarter and not harder. I hired a number of mentors, coaches, and business consultants. I dedicated my life to learning about business management, leadership, marketing, and communication. When I learned how to communicate more effectively with my patients, I was not required to advertise, accept different insurance plans to generate 300 new patients per month for me and the dentists who worked in my practice. I was able to earn more, work less, and take a week vacation once every 2 months. As a matter of fact, I was able to take home more money with only 50 new patients a month and have fun doing what I wanted to do. I was able to attend various certificated residency programs in prosthodontics and cosmetic dentistry. I was able to go through Mission Institute, the Las Vegas Institute, the Ritz-Carlton Leadership, Disney University, and John Maxwell Leadership Training. At age 47, after owning and selling more than 15 dental practices, I decided to retire myself from clinical dentistry and pursue a career as a dental management consultant and get my MBA in investment banking and private equity. I did all this as I saw a need for someone like me to bring complete solution to dentists that can help improve their game. Just like patients that we have in practice require someone with comprehensive skill set to help them go from where they are to the ideal optimal health, dentists also require to have a consultant that can show them the way and guide them to where they want to end up. This is not possible unless the consultant has been through the journey and understands how to get a client all the way there. I'm proud to say that I have been able to go through this journey not once but several times with my own practices as an investor as well as a consultant developing, scaling, and exiting businesses successfully. Now, since nothing can happen for a dentist unless they're able to have a strong cash flow, have enough time on their hand to devote to improving their practices, scaling them, and hopefully someday selling it for large amounts of cash, I have decided to help them to master their communication skills so they can get more patients say yes. When I started out, not knowing better, my focus was to see as many patients as possible and take every dental plan out there. However, after my health setback, I began not only become a better clinician, but also attract high-paying fee-for-service patients to my practice. I was no more competing on price, but the high standard of care and value I brought every patient. I began to attract quality-focused patients. These were ordinary people, but also many millionaires and billionaires. I ended up working on people such as Mr. Bill Gates, Koch brothers, Elizabeth Koch, Ralph Burnett, Dennis Washington. This is no way to try to impress you, but impress upon you that these people, with their massive amounts of fortune, have many choices, but yet somehow they saw something of value within my practice. This is what I want to share with you as how you too can have a practice that is focused on value creation, one that can earn you 10 to 15 times more money than an average dental practice, allows you to work only 3 to 4 days a week if you want to, and do the types of dentistry you enjoy. I have put together a very specific course for you and your dental team to learn how to build a highly successful practice. You may ask, what is successful? Success can be defined differently by different dentists. Some may consider success when they can work 3 days a week and produce $1 million a year with a 50% overhead. Others may consider success when they can do the work they enjoy predictably with happy patients. Others may want to have 5, 10, 15, 20, 50, 100 offices and make their company a national chain. Some may want to grow a single office to a $5 million revenue and take home $2 million a year. Others may want to grow their dental department or bring more revenue to their university. Whatever your definition of success is, I can help you achieve, earn more, work less, and do your work with less stress. It all starts with learning how to communicate better with patients. Once you master your communication skills, you will improve your odds of patients saying yes to you. This program consists of 5 video presentations and will take you through a patient's mindset as well as every step in the sales cycle. Let me review with you what you and your team will learn through this program. Lesson 1. Contact phase. What is the real definition of sales? Why sales is important to individuals and companies. Understanding the 2 different types of treatment planning model, fear versus want. Learning the real reasons why patients pay for treatments. The difference between features versus benefits of a treatment and how to use them to communicate with our patient. learning why elevator pitches are important and how to construct them. Identifying emotional turnoffs can become silent killer of your sales. Lesson 2, Clinical Discovery Assessment. Introduction to handoffs and why they're important to build trust and confidence with your patients. Understanding the power of good questions and 4 major questions that we must have the answer for proper treatment planning. Learning about open versus closed-ended questions, reviewing scripts for all clinical situations, understanding why intraoral photography is absolutely necessary for patient communication, and how to discuss and determine patient's budget. Lesson 3, Presentation. Understanding when to present the treatment in relation to the clinical examination. What are the times of the day that the patient will be more receptive? Where the presentation must take place and do's and don'ts. How to present treatment plans to avoid patients picking and choosing treatments and becoming price focused. Lesson 4, Mastering and Handling Objections. Why most dentists confuse complaints with objections. Learning the top 3 common objections in dentistry and how to handle them. Identifying the biggest objections in the sales process that is not from the patient but the dentist or the dental team. Learn how to isolate objections and validate them before handling them. Learning the sample scripts for every common objection scenario. How requests for discounts must be handled. Lesson 5, Closing or Coming to an Agreement with Patients. Why closing questions must be asked. Why patients expect us to ask a closing question. How soon a closing must be asked. What are the different types of closing techniques and how they can apply to dentistry. How to get your patients committed to a treatment after they have agreed to prevent cancellations and no-shows. How to collect large deposits or payments in full before the appointment. As you can see, this is a very comprehensive program that is the result of my nearly 30 years working as a dentist, as a dentalpreneur, and as a consultant working with hundreds of offices. As an additional bonus for ordering these lessons, I will add the following presentation free of charge to your Sales Mastery curriculum. Free video bonus number 1, Elevator Pitches. A complete presentation on elevator pitches with sample clinical elevator pitches that can be immediately used by your dental team. Free bonus video number 2, Increasing Transaction Volume. In this video, I will introduce you and your team to the concept of upselling, cross-selling, bundling, cross-referral, and cross-promoting to increase each sales transaction, adding substantial revenue to your office. Free video bonus number 3, Smile Design Principle, what looks good and what needs to be improved. In this video lesson, your team will learn about the smile design principles and how to identify what looks good and how to communicate what needs to be improved with your patients. These lessons are guaranteed to immediately increase your income, and if you become truly committed to following the principles laid out in these lessons, you will reach the ultimate levels of income. However, I have to warn you that you must have the clinical skills to back up what you're trying to recommend to your patients. Otherwise, you will face many problems such as giving refunds or may find yourself in a lawsuit. It is my sincere intention to get these lessons out to as many dentists as possible across the globe and change the way dentistry is being treatment planned and communicated with patients. I hope to begin teaching these in dental schools. The cost of this program compared to the return on your investment is absolutely nominal. I've had dentists who used to make $75 per hour and their productions have gone up to $500, $1,000, $2,000, $3,000 per hour, depending on their skill set and how competent they are as a dentist. I have charged clients previously $40,000, $50,000 per client per year to coach them through this program. However, because I want to reach to as many people as possible on every corner of this earth, I have decided to bring this program to you as an online platform at a fraction of the cost and is available to you 24/7, 365 days of a year. This program is not a quick to get rich program. It is not a substitute for great clinical skills and is for those dentists who want to treatment plan their patients based on strong morals and ethical integrity. If you have an open mind and like to take your earning potential to the highest level possible in dentistry, work smarter, not harder, I strongly recommend that you sign up for this program and begin practicing these principles with your team. You're guaranteed to see results immediately. I'd like to thank you for your attention, and I hope to see you on our online campus soon. Please follow me on Instagram at Dr. Alan Nazeri for daily lessons.